Okay, so in this tutorial we're going to look at the branches of the brachial plexus. So this follows on from the first tutorial I did, which outlined the location and the sort of anatomical relations for the brachial plexus. So you can see here I've got a dissected brachial plexus. We've got the roots C5, C6, C7, C8, T1 here. We've got the trunks, the divisions lying under the clavicle, and then you've got the cords distally. So we've got this nice diagram here. So we've got the roots C5 to T1 here. We've got the trunks, the superior, the middle, and the inferior trunk. We've got the divisions. So each trunk divides into an anterior and a posterior division. And then we've got the cords. So coming off the roots, we've got two nerves that you need to know. So the one up here is called the dorsal scapular nerve. So you can see its origin here on the C5 root. So the dorsal scapular nerve innervates the rhomboid muscles. So you can see the rhomboid muscles here, the minor and major, rhomboid minor and major, attaching from the spinous processes to the medial border of the scapula. So that's innervated by the dorsal scapular nerve. And the other nerve that you need to know that comes from the roots is called the long thoracic nerve. So this originates from three roots, so C5, C6 and C7, and it innervates the serratus anterior muscle. So this is the serratus anterior muscle, which attaches to the ribs and to the costal surface of the scapula. So from the roots you've got the dorsal scapular nerve innervating the rhomboids, and you've got the long thoracic nerve innervating the serratus anterior muscle. So next we come on to the branches of the trunks of the brachial plexus. So just like the roots, there's only two nerves you need to remember, and also they come from the upper part of the brachial plexus. So the two muscles you need to know both begin with S, and they both come from the superior trunk. So I just remember them as the S nerves. So you've got superior trunk and you've got two nerves beginning with S. So you've got the suprascapular nerve and you've got the nerve to the subclavius. So subclavius and suprascapular nerve. So the nerve to the subclavius comes from the superior trunk and it innervates the subclavius muscle, as the name suggests. So the subclavius muscle is this little muscle here which sits between the first rib and the clavicle. So it originates on the first rib and inserts onto the lower part of the clavicle. So the other nerve is the suprascapular nerve, which you can see coming off here. So this nerve innervates the supraspinatus and infraspinatus. So the suprascapular nerve is called the suprascapular nerve because it supplies muscles which sit on top of the scapula, so they're suprascapular. So you can see here you've got the supraspinatus sitting above the spine of the scapula and the infraspinatus sitting below the spine of the scapula. So these muscles are innervated by the suprascapular nerve, and these two muscles are part of the rotator cuff group of muscles. So next we've got the divisions of the brachial plexus. So you've got the trunks dividing into anterior and posterior divisions, and the divisions don't have any branches coming off them. So after the divisions you've got the cords, which are formed from the divisions joining together. So the superior trunk gives off an anterior division which becomes the lateral cord when combined with the anterior division of the middle trunk. So the posterior cord is quite easy to remember because it's right at the back, so it receives all the posterior divisions of the three trunks. So you can see this division here coming off, the posterior division of the superior trunk, the posterior division of the middle trunk, and the posterior division of the inferior trunk coming together to form the posterior cord. So the medial cord is formed by the anterior division of the inferior trunk. The posterior cord is formed by the contribution of the posterior branches from all three trunks, and the lateral cord is formed by the anterior divisions of the superior and middle trunk. So it's useful to get your head around these anterior and posterior divisions because the anterior divisions give rise to chords which are associated with the anterior compartment, and the posterior divisions are associated with the posterior chord, which is associated with muscles of the posterior compartment. So because the lateral and medial chords are formed by anterior divisions, they are associated with muscles to do with the anterior compartment, and because the posterior chord is formed from posterior divisions, it's associated with muscles of the posterior compartment. So what I'm going to do now is, before talking about the nerves which come off the sides of the chords, I'm going to talk about the terminal nerves. So you've got 5 terminal nerves, which is where these chords terminate. So there's a simple way of remembering these terminal nerves with a mnemonic, which is fairly memorable. So it's my auntie raped my uncle. So not the cleanest mnemonic, but it helps to remember things. So the first nerve is the musculocutaneous nerve. Then you've got which comes off the lateral cord. Then you've got the axillary and radial nerves, which come off the posterior cord. You've got the median nerve, which is formed by 2 branches which come off the medial and lateral cords, so they unite to form the median nerve. And then you've got the ulnar nerve. So my auntie raped my uncle. Musculocutaneous, axillary, radial, median, ulnar. So now you know the terminal nerves of the chords. We can now look at some of the branches that come off the sides of the chords. So we'll start with the lateral cord. So you know from the mnemonic that the terminal nerve is the musculocutaneous nerve. And you also know that the median nerve is formed by branches that come off the lateral and the medial cords. So as well as the musculocutaneous nerve, you've got the lateral root of the median nerve. And then you've got this little nerve here coming off the lateral cord. So this is the lateral pectoral nerve. And this innervates the pectoralis major muscle. So the pectoralis major muscle is this large muscle here. So now we'll talk about the branches coming off the medial cord. So you know that the median nerve is formed by the union of branches that come off the medial and lateral cords. So the lateral cord provides the lateral root of the median nerve. So the medial cord therefore provides the medial root of the median nerve. And you also know from the mnemonic that the ulnar nerve is the terminal nerve of the medial cord. So you already know that we've got the medial root of the median nerve and we've got the terminal ulnar nerve. So we've got a few other nerves that you can see. So we've got 3 other nerves. So these are pretty straightforward to remember because they're the M nerves. So remember the S nerves on the superior trunk. Now we've got the M nerves on the medial cord. And it's quite easy because you know that there was a pectoral nerve on the lateral cord. So the lateral pectoral nerve. So we've got the medial pectoral nerve on the medial cord. So the medial pectoral nerve is the most proximal nerve coming off the medial cord. And then you've got 2 nerves to do with sensation to the skin. So you've got cutaneous nerves. So you've got a cutaneous nerve to the upper arm and you've got a cutaneous nerve to the forearm. So the arm comes before the forearm. It's more proximal than the forearm. So the more proximal nerve is the medial cutaneous nerve of the arm. And then after that you've got the medial cutaneous nerve of the forearm. So you might also hear these nerves referred to as the medial brachial cutaneous nerve and the medial antebrachial cutaneous nerve. So brachial just refers to arm and antebrachial means forearm. So this diagram here just shows the sensory distribution of these nerves. So the medial cutaneous nerve of the arm supplies the skin over the medial side of the arm. So you can see this thin strip of innervation here in yellow. And the medial cutaneous nerve of the forearm has a larger distribution of where it innervates the skin. So that should be quite straightforward. So from the mnemonic, you know you've got the medial root of the median nerve, and you've got the ulnar nerve, which are the terminal nerves. And then you've got the 3 M nerves. So you've got nerves to do with the pectoral muscle, and you've got nerves to do with the supply to the skin, the sensory supply to the skin, so the cutaneous nerves. Okay, so with the posterior cord, there's a nice mnemonic for remembering the 5 branches. So from the mnemonic before, my auntie raped my uncle, you know that the axillary and the radial nerves come off the posterior cord. So you've got the axillary nerve here and the radial nerve here. So the other mnemonic for remembering nerves from the posterior cord is ultra. So you've got the upper subscapular nerve, the lower subscapular nerve, the thoracodorsal nerve, and then you've got the radial and axillary nerves. So first we've got the upper subscapular nerve, or the superior subscapular nerve. Then we've got the thoracodorsal nerve, and then distally here we've got the lower subscapular nerve, and then the axillary and the radial nerves. So remember we saw the suprascapular nerve coming off the superior trunk here. Now we've got the subscapular nerves. So the suprascapular nerves innervated muscles which sat on top of the scapula. So now the subscapular nerves innervate muscles to do with the underside of the scapula. So the upper subscapular nerve supplies the subscapularis muscle. So the subscapularis muscle is this muscle which sits underneath the scapula and internally rotates the humerus. And then you've got the teres major muscle, which also medially rotates the humerus. So the upper subscapular nerve supplies the subscapularis, and the lower subscapular nerve innervates the subscapularis and the teres major muscle. So the thoracodorsal nerve innervates this large muscle which I've just added onto the model. So this is the latissimus dorsi muscle, and this adducts, extends and medially rotates the humerus. So that's the branches of the posterior cord. So remember the mnemonic ultra. So U is upper subscapular, so that's the most proximal branch of the posterior cord. L is lower subscapular, so that comes after the thoracodorsal, which is the T part. So T is thoracodorsal, and then you've got RA, so radial and axillary. So that's ultra.